Hi, Teresa Nutt here. Wanted to give you a quick overview for the clinical conditions class to the common experience of people living with clinical conditions. And the purpose of this PowerPoint is to really help you to start to build empathetic awareness for the many components that people with clinical conditions face. Here's a look at the topics we're going to cover. I'm not going to read them because we're going to go through them one by one. So chronic pain, just framing it up. Millions of Americans suffer from chronic pain, but people with chronic clinical conditions are at an increased risk of experiencing pain. And the symptoms from clinical conditions can increase or heighten the experience of pain for people. So in other words, because you're already not feeling well, because you have symptoms of some kind, pain can feel more heightened to you than it would for an average person who does not have a clinical condition. And finally, just to point out, there's a relationship between mental health and chronic pain, and one tends to make the other worse or more prevalent. So if someone has depression and anxiety, they're going to have a heightened experience of their pain. And people with clinical conditions often have both a mental health component and pain as a part of their condition. So taking a look at the mental health component, a third of people with a chronic clinical condition will suffer from depression, and those with more severe physical symptoms will be at an even higher risk. And unexpected major life changes are a complication for many people who have chronic clinical conditions, and those changes are going to cause an increase in stress, depression, and anxiety. Changes like work and career, social life and relationships, independence, financial security, and dreams and aspirations. We also want to introduce you to a body of knowledge called the ACE, or Adverse Childhood Experiences Research, that Kaiser Permanente did starting in 1995. Really, the purpose of the research was to take a look at the childhood life experience and exposure to abuse, neglect, and household dysfunction, and the result of that in the adult person, and they found a correlation between the two, meaning a person who experienced abuse, neglect, and household dysfunction as a child had higher prevalence of physical and mental health challenges as an adult. And as you can see, that exposure is 4 to 12-fold increased risk for mental and physical health conditions, including depression, heart disease, cancer, smoking, obesity, lung disease, and autoimmune disorders, all of which we're going to talk about in this course. We want to give you that as a backdrop and to let you know that there is a questionnaire that you'll have the reference to. So if you're working with a coaching client, you can certainly have them take the questionnaire for their own self-awareness and maybe to give you, the coach, some feedback. But to know that this is one of those gray areas where it could quickly fall into a mental health category, so you'll want to have some really good mental health referrals at the ready, or someone that you can consult with, psychologist, counselor, therapist, etc. And stages of grief really falls into the mental health category, and we use the same stage of grief process as you learned in Fundamentals 2, which is Elizabeth Kubler-Ross's. And she has 5 stages: denial, anger, bargaining, depression, and acceptance. And just to note that people will experience several losses as they progress with their clinical condition. So grief is a very real part of it, and in the Seelig and Overman book she talks about waves of grief, so you'll read about it. But knowing that grief is a very real part and will come back more than once when a person is dealing with a clinical condition. A couple of reminders: people will not go through these stages in a logical or linear fashion. They tend to move around the stages and sometimes go back and forth, and they will move through it in their own time frame. So we can never really know or predict how fast or how slow. But I think also as a coach you need to be tuned into when you feel like they've been stuck maybe a little too long, and there are some things happening for you in your mind that make you think maybe they need a mental health referral. So I think there's grief, and then there's complicated grief where they really actually need some counseling or psychotherapy to help work through it. So just know there is a fine line. There are several things that impact relationships in support, and the first two are really related, and that is that family and friends may struggle to understand the person's new normal. They want the person to go back to how they used to be. And it may not even be intentional, but that can be how they interact with the person. And the symptoms are often largely invisible, whether it's foggy brain or inability to concentrate or pain or whatever it is. It can be hard for people to understand someone is sick because the symptoms aren't obvious. Others will give well-meant advice, and your coaching client might come to you and say, "Oh, I'm just so frustrated. I feel like I'm trying everything, and everyone keeps bombarding me with their ideas for what I should be doing, like I'm not trying hard enough already." So just know, again, you'll read about several of these things in the book. Emergency plans are important, and so in order to have emergency plans, obviously you need key support people, and we'll talk about them with different conditions, so that's going to come up again. But many clinical conditions require some kind of an emergency plan for the really, really bad or trying times. And then the last category is really around energy for intimate relationships, and that comes through as sexual intimacy, ability to be a provider for the family, ability to parent, the energy to be with your spouse or your parents or siblings, other loved ones, and also just a real risk for social isolation, because if you have less energy level and more troubling symptoms, then you may not be participating in your normal activities, which makes your social world a little smaller. And we also wanted to include the caregiver world in this part of it. Most caregivers are not medical in their training, or their background is not medical, so they really struggle to navigate the medical system. They're juggling caregiving with their own life, meaning they may work or have children to raise or something else, and their own personal well-being can end up getting put on the back burner. They also talk about the sense of hypervigilance, where even when you're not with the person you're caregiving for, you're constantly thinking about what's going on for them and what they might need. And it may be difficult for them to find respite so they can take time away. They may not have great support systems. Again, if they're really busy, they're not able to keep up their social interactions. And research has shown that those who do prolonged caregiving are at increased risk for their own health conditions, so it's important to note that. Obviously, as a person comes to terms with their clinical condition, they're going to have to work through their own self-love, self-acceptance, and personal expectations. And some of those will come through as like body image changes, or coming to peace with the feeling of I can't do what I used to do and I really wish I could, or this is my new normal, how do I really feel about that? The loss of dreams and aspirations can be huge. And then there can be this exploration of what's the meaning and purpose of my life, and what's my value now that I'm not the person I always thought I was. I also want to talk just briefly about patterns of thought. And there are three I think that are really important. One is biases, meaning based on life experiences, we think about certain conditions in a certain way, like if I get cancer, I will die, or I'll have chemotherapy and lose all my hair, or if I get diabetes, I'm going to lose a limb. People have these very real biases, and it would be important for you as a coach to address those with them. And I would also challenge you just personally to understand what your own biases are. And then stress management. Really, how do they usually manage stress? And is that supporting their process of coming to terms with their clinical condition or making it harder? And most of us simply don't have great stress techniques in process before we hit a crisis. So it's just really good to kind of check in and find out how they normally manage their stress. And then limiting beliefs and habitual negative thoughts. And those sound like, I hear things like, if I had been a better person, I wouldn't have gotten sick, or I should have known this sooner, or whatever, bad things always happen to me. You can kind of get the flavor of it, but people really can tend to have, as a pattern in their life, a way of looking at the universe as an unfriendly place, and so that can really impact their management of their condition. And really, coaching is uniquely designed to help uncover and work with some of these patterns of thought in ways that other areas of expertise probably aren't. So I wanted to bring that to your attention. And then work and career. People have several things they have to do about work and career, and one can be just managing symptoms at work and finding key support people at work. The other can be really honestly the need to change careers or leave careers because of their symptoms. And these symptoms are not always physical. Again, it can be lack of ability to concentrate or think clearly that really makes it impossible, or a level of fatigue to do the work they've always done. And on the flip side, people can make career changes based on assessing the meaning and purpose of life. So there are several things that can happen here. Also, finances. I just want you to really be aware that finances and the cost of medical expenses can be really a huge factor. So people are dealing with screening, medical appointments, daily maintenance, medications, medical supplies, medical equipment, integrative therapies that are largely out of pocket, etc. So the cost can be pretty substantial. And we often think, well, they have disability, but as you see, it only pays a third to two-thirds of their working wage. So it can be a very significant change in their lifestyle if they need to go on disability and can no longer work. And just as a reference, research that I did 5 years ago showed that a third of all bankruptcies were a result of medical expenses. So it can be quite severe, the financial impact of a clinical condition or the need for medical treatment. And then, of course, there's this thing around insurance, lifetime maximums, premiums, what's covered and what's not, etc. So all of that comes into play. We're going to just roughly brush over lifestyle management because you've had both lifestyle medicine and functional nutrition. But obviously these four things are critical to managing any clinical condition, and they are sleep hygiene, nutrition, exercise, and stress management. And with nutrition, I just want to point out that food is medicine. We look for an individualized approach, and we want to refer to quality, integrative, and holistic resources. We as coaches are not going to be the experts for the most part unless we've had extensive training. And I would say the same with exercise. And when we talk about food as medicine and other integrative interventions, we want to take in mind some of these considerations. And one is that vitamins and supplements can affect how a person's body processes medicine. This is why we want you to be careful as a coach about making recommendations, because when people get on medication, their biochemistry is changing. And so you need to know all the science between the medication they're on and the integrative intervention. And so without expertise, you can be setting yourself up for some kind of treacherous water. So we just highly recommend you have some experts on standby that you can refer to. And certain foods and drinks, so when we say food is medicine, certain food and drink change the way a person's body processes medicine and can also worsen the side effects of their medicine. So it's important to know that. And finally, keep an open mind as a coach, because as is true with any kind of treatment, whether it's conventional or integrative, they will work differently for different individuals. So there's not going to be a one-size-fits-all. And you're going to have a chance this semester to really build your library of what works well for different conditions.